Welcome back, everyone, to the Functional Code. We are excited to bring to you guys today a new podcast. We are going to be talking about flexibility and is your typical stretching routine helping or harming you when it comes to getting ready for activity, possibly even increasing your chance of injury. And there are a lot of misconceptions about stretching and rehab and things to that nature. So we're going to dive into all of that today. Dr. Jace is going to do a great job. So as always, I am Dr. Addy.
And I am Dr. Jace. Yeah, we're going to get into some principles and give you guys some general understanding of how the nervous system communicates and attaches to the body and vice versa. So you can actually use some of these ranges of motion. Because I don't even know, quite honestly, when the last time I even stretched before. No. Everything was all active.
Yep.
And if you know how to utilize certain aspects of your body, you won't necessarily need to go into stretching technique. It then turns into a kind of a mobility technique slash habitual pattern, kind of movement habit, if we will, on that.
And loading tissue.
Yes.
So we're going to talk a lot about motor units, recruiting a lot of motor units, neurological input with that, what that does to the actual tissue itself. And just the other day, Dr. Jace was working on me. I had a wicked spasm. I think I had a rib out, all the other fun things that can happen. And most of what I was doing was loading my tissue. I had a really tight trap area. So I was lifting heavy things and I was putting isometric holds on that area, and I was just trying to engage as much information to that area as possible, along with getting adjusted, which helped immensely. But a lot of that started to reduce the tension in that area. I wasn't doing this and trying to get it to a certain way. But I wish more people knew about how to more effectively manage something like that
100%.
Without getting just stuck in this state of pain forever and not getting any outcomes. Yeah, we're excited to bring to you guys some tools, some value that I think might change your way of thinking and definitely will promote way more outcomes than you realize. Let's get into this. So
beautiful.
Let's first start with why this matters. So what are some, we'll call it false claims or even misconceptions around flexibility, and you want to just bring them through, let's just call it things that we've maybe thought about in the past and why we need to change the way we think now, just regarding the misinterpretation of stretching and those kinds of things.
Absolutely. So let's start with some of the main basics. So when you look at and understand that your body is trying to conserve energy, just naturally, it's what it's built to do. When you're not able to go into certain ranges of motion, when you're not utilizing the ability of your body to go and open up and move fully, honestly, that's where your body's going to conserve that energy and it's going to restrict. That's going to be via signal of your nervous system, brain to tissues, to increase range of motion, to feel like you have the flexibility, that a lack of stiffness. A lot of that is a guarding mechanism of the body. And if your body feels like it's not safe or if it's unfamiliar to move in these different areas, it's going to be constricted for longer periods of time, which can last decades long from there. So
for sure,
when you look at the flexibility and the ability to move, a lot of it is communication through the nervous system back and forth. So there's certain things known as passive range of motion, where someone moves your arm or someone moves yourself without your control. And that's where you can see, so for example, for the people that are not watching this, let's think about the shoulder. If someone else is assessing you, whether it's a practitioner, friend, family member, doesn't matter too much, they hold the forearm and they're moving your body, your arm, through the biggest circle you possibly can. If you remember workspace or controlled articular rotation cars, you'll have a general understanding. You're going to notice that there's a difference between someone else moving that limb, passive range of motion, and active range of motion, where actively you're controlling it, you're moving your arm through the biggest circle. And there's a difference between passive and active. Almost always, I can't think of a time to where it hasn't been. Passive range of motion is going to be, you're going to be able to move there at the most. And you're trying to almost shrink that gap between what you're actively able to control and what is physically possible. So that's where you can get into what are the limitations, what are some of the things that can be a barrier for that. And a lot of that comes back to the joint space in the body itself. because the joints are going to be the first signalers to the brain, to where if there's any problem in any joint, it's going to send a signal to the spinal cord, straight up to the brain, no delay. Where some of the overlying muscle tissues and tension go to the spinal cord, slight delay at an inner neuron, and then kick back up to the brain. So if there's a problem at the joint, it's already going to send that signal up to the brain and back before the overlying tissues, which if you rehab and look at on how you can improve your flexibility, improve your range of motion, you have to start at the joint level first
100%.
because of that signal. Now, to increase and bring that difference from your active range of motion to your passive range of motion, that involves your nervous system ramping up or controlling a contraction, which we'll get into certain tactics here in a sec on how to do some of that. But that's the premise of the communication to the body and brain, starting at a joint level, and then from there you have to ramp up the nervous system to tell the brain to the body to be able, okay, it's safe to move in this area, in this range of motion. We're going to release the muscle guarding. And the muscle guarding, taking a side look at this, it can come from injuries, whether it's a motor vehicle accident, whether it's a fall when you're like at a kid early in life,
Yep.
whether it's you haven't used this, your arm or this body part forever, for decades long, and now you're having compensations above or below that area. Let's say for lower back, you're having knee problems, foot problems, shoulder problems. But if your lower back's not able to move, all these other areas are compensating because of the lack of movement in one area. So then you start at the joint level first. You open up that range of motion. You create that connection between brain and tissues. Also at the same time removing and reducing all these other compensations above and below, and it can open up from there. So there's a few different principles. Once you have a general understanding of where you need to go and the reason why you're not flexible, there's a lot of different small variables in place from there.
I just literally heard Galpin talk about this on his podcast the other day, and he explained it as motor units. So
Yes.
if we were go to lift a feather, he goes, your body is going to try to use as minimal amount, he liked to use the words minimal amount of motor units as possible. Back to your conservation of energy theory,
Yes.
which is so, I think that helped me understand a lot more.
Yeah.
And he goes, okay, now you're going to go pick up a couch. He goes, guess what? Your body doesn't switch it and gives you the maximum. It's still the same. It gives you the minimum. It's trying to give you the minimum amount of motor units to complete that task.
Yes.
And so when you understand that, it's now a war. You're trying to gain as much motor unit involvement via the brain as possible.
Yes.
How do you do that? How do you continue to ask for more involvement of motor? How do you train that? How do you approach that? And that, to me, I think made a lot more sense to how I could explain it to the patient. Why am I not able to move this way? It's, have you asked for it?
Love how you said that.
Have you actually tried to recruit more motor units? Because you just trying to move it one way, you don't have the neural control. There's no capsule integrity movement. There's no function. There's no, like, you completely take away all the things that would increase and gain more motor unit control. Just simple range of motion doesn't break down the neuromuscular component, doesn't really cause contraction. All these other things that are needed for more information and messaging to that area. And I like the way you said the conservation of energy, because I think that makes a lot of sense when we're trying to explain this to patients.
Yeah, it follows a lot of the rules of the universe. And I love the comment that you brought up with that, because I think explaining it in a couple different ways will get your mind thinking of it's not as simple as people think.
No.
So when you're looking at, and let's break apart from this way of like standard like training, like workout training of, let's say, am I working my bis and tris, my bicep and tricep today? Am I working my arms? Well, it's a little different than that. So going back to the motor units, especially with Dr. Andy Galpin, let's say if you would look at the image of cutting your arm in half, obviously it's a terrible image, but if you can think about the muscles that would face you if you're cutting your arm, and you can see that there's different parts of the muscle belly. Now, in terms of motor units from the nervous system to the tissues, if you're going through repetitive movements, let's say bicep curl or skull crushers with tricep extension, you're going to only utilize excuse me, certain motor units in that specific spot of the muscle belly. And then you have to think, okay, it's not just a bicep. Each muscle, each bicep has a bunch of different motor units and a bunch of different layers and bundles and fascicles within it. And that goes into, when people think about fascia, and we're going to get into this in a later part, to where the epimysium is the outer layer between different larger muscle groups, and then it goes and separates into perimysium and then epimysium, or excuse me, endomysium. So there's different layers of fascia, and then more or less each muscle falls along the same pathway as the sliding filament theory, to where when actin and myosin contract and relax, the part that they don't talk about is that they also permeate laterally. So there's like a rotational component, because you're looking at and thinking about a 2D structure versus a 3D structure. So knowing the different layers of muscle tissue, knowing that the motor units attach to different fascicles, which is deep portion part of one part of this muscle belly, and if you're activating one of these parts of the motor units, you're not activating a different part that doesn't have a stretch reflex. You're not activating over here. What are you training? If you go through this repetitive cycles, you're recruiting the same motor unit you've been recruiting all along. Unless you change the angle, unless you change the direction, the parameter, and how you load those tissues, you're not going to adapt those other motor units. Which then goes into the next part, that if your muscles outworked your connective tissue, i.e. ligaments, tendons, those will yield, the soft tissue, connective tissue will yield due to injury. There's the tendinitis. There's the other injuries of, let's say, for lower back, for example, I bent down and my back gave out. You probably didn't have the musculature, the connective tissue to hold everything in place. And that's where you see shifting of certain ligaments and laxicity of the spine, then discs come out. There's injuries to the shoulders, like any other part of the body, because any injury is almost like a mathematical equation, to where you're not either able to absorb or move into one direction if you haven't trained it. If certain tissues aren't able to absorb that force against gravity or that direction, they give out. So that goes into the specificity of training, but train all the motor units, train as much of the muscle belly as you possibly can, not only locally, but whole systemically wide as well.
And I think you might have to go back and watch that again, because there was a lot of information there. But points. I do think trying to understand that is going to change how you train. It's going to change how you try to help out an ache and a pain from your day-to-day life. And it should hopefully get you to understand that if you have practitioners or providers who don't understand that yet, you're going to be given just such a different protocol than what Dr. Jace gives patients and what we work on in the gym, and all the ways that we train our bodies differently. And we're going to talk about what that looks like, but just your simple this stretch, go and do this and this that you might get from all your providers, PT, what have you, that isn't even level 1. That's like level 0.5, 0.3. And we're not even scratching the surface on improving you, directly improving you, using these kinds of mechanisms anymore. So there's just so much more that's needed coming from the joint first. And how to truly impact that right away is going to be much more effective. Even 100%. In the first session or two, you're going to get so much better outcome than what a typical first session is for most patients.
And we see this quite often with most other individuals, or they've seen many different providers for a certain condition that they can't necessarily heal. And then you start thinking, okay, what are the other ways that you can heal? If you're not doing any specific training for certain specific structures, no wonder why it's not healing. No wonder why you're still having the same problem. And that goes into what we've said previously in other podcasts, where you can train/rehab joints different than ligaments, different than tendons, different than muscles. And each one needs a different stimuli and a progression of stimulation to rehab, to build up, just so you can prevent injuries, so you can increase your flexibility, range of motion.
And all of those should be targeted. You shouldn't forget some of those. A lot of people simply work muscle regions only. And like you said, we get to that point where muscle belly overcomes the tension away from joint and ligament and all those, and now we have injury.
And let's take it even a step further. And some of this we'll get into pods, strength versus hypertrophy, and different ways that you can build up. But if you build up and if you have that strength, if you have the muscle mass, you don't have to keep building that up. You can almost put like a pin in it and maintain that to where that specific intensity, that specific exercise, you only have to do that maybe once every 2 to 3 weeks to keep the resources of those tissues, to keep that nervous system communication, those motor units.
If you just want to maintain.
If you want to maintain.
Of course, yeah.
But you have to get to that exact same intense stimuli, every 2 or 3 weeks. So if you want to ramp it up and let's say you want to keep the strength of your chest, but you want to work on other areas more so, schedule it out. Go and address, let's say, the chest. You want to keep that strength there, so you have to go back to that same intensity, that same like amount of weight you want to move and put it on the calendar. That's the day that you're going to create that signal to that tissue to make sure it maintains as well. But you can work on other things outside that 2-3
And you had broken
range.
down in a table of when you should be training those per category. I think speed, power, strength, making sure what was the minimum.
Yes.
And I can't remember what pod that was, but.
And I didn't break it down. It's probably one of our earlier ones when we first started off.
That was helpful too. But I think like you talked about doing a strength versus hypertrophy. We could maybe tackle that a little bit better.
Yeah, we'll go into that more specifically.
So Doc, most patients, for sure, when they have an issue, the first thing that they think about is either passive stretching or some type of simple stretching, static stretching mechanism. Do you want to just highlight why that can be actually more detrimental to their health, and what's some of the research behind that?
And we can go into static versus dynamic stretching with this as well. So passive versus active, someone controlling that range or those joints versus you actively controlling it. And we want to close that barrier between active and passive. And to preface some of this too, and especially if you're someone that's listening that's a gymnast or that had a lot of flexibility at one point in your life, but you don't do those same activities, you don't do the dance, cheerleading, gymnastics, and then now you're maybe a little bit more in a sedentary lifestyle, I'm sure you're noticing that you're either having more joint problems, more muscle aches, more muscle guarding. And that's because when you have that flexibility, when you're able to control that large range of motion, but then you don't utilize it, there's a difference between the brain-body connection, which opens up that premise to where you want to pretty much bring that passive range to active range, close that gap, and what are you actively able to control at that time? That is something that you can open up and utilize from there. So in terms of, let's say, a static stretching position. Now, in order to decrease the muscle guarding and to help with, which is known as like fascial plasticity, which more of it comes from the guarding signal of what's known as gamma motor tone, to where the body and the nervous system, that communication is able to like, okay, it's safe to move in this area. We're going to give it more range of motion. We're going to give it more area to where you can move that limb, that joint, that body part into. But that comes through nervous system communication via muscle contraction. So then we start looking at, okay, what are different ways that you can open up the range of motion and increase that brain to body connection? If you're going to a static stretching, so there's a bunch of different studies, anywhere from 2 to 31 minute holds can help that connection, and that's without even nervous system. But you need a good probably 4 to 8 week time frame to where you're gonna start noticing, oh, I have a little bit more flexibility, or let's say I'm trying to bend down, touch my toes, but I can't necessarily, when I first start off, can't touch it. After each session, you start noticing your body is able to turn off some of the muscle guarding from the hamstrings, from the lower back, and it's okay, it's safe to move in here. But it's different from holding the stretch, let's say for 2 minutes, versus actively trying to bend down your tired shoes or bend down and pick up a soccer ball that was kicked to you without your back giving out. So there's the difference between the nervous system's communication down versus you just holding that position. Then that's the difference between dynamic and static, to where if you're holding that static stretch, try to contract or squeeze whatever area that you feel the most stretch, even if it's just a light contraction. Let's say, for example, you're trying to bend down, touch your toes. I'm noticing a lot of pull in my hamstrings or the muscles behind the thigh. From there, okay, maybe if my foot's in front of me, am I able to put pressure of my foot down to the ground or just even squeeze my hamstring muscles, the muscles at the back of your leg? And from there, you're able to communicate that nervous system when everything is stretched. So when it goes into it over amount of reps and sessions, it's familiar with it. It turns off what's known as that gamma motor tone. It improves the flexibility. And that's just on a tissue level via communication through the muscle spindles and Golgi tendon organs to understand that tension, understand that stretch to get into that range. But let's say, for example, that's addressing the muscle belly specifically and a little bit on the tendinous aspect. Again, going back to the communication between joints and brain, if we want to start the rehab process, that's where workspaces, joints, working your joints, doing controlled articular rotations or CARs come into play. So you would first want to start active mobility. For example, for those people that are not watching on the video, shoulder workspace, shoulder CARs. We want to move this shoulder, this ball and socket joint independently from anything else. So it's controlling, making the arm straight, making the torso straight, and then we're going through the biggest range of motion you possibly can, sharp, pain-free. If you have that diminished angle, go around it, but with that, we're able to communicate to the end ranges of that line of tightness to give the body in that signal more familiarity, thus increase range of motion. And also for CARs and joints, it's getting that joint through the biggest range of motion to help for the synovial fluid exchange on the edges. It also helps for blood flow on the edges as well. So you have blood flow, you have joint fluid, synovial fluid, you have the brain's communication. It accelerates the tissue healing. And then it subsequently turns off some of the muscle guarding, thus increase range of motion from there. So two things to kind of follow back up. Moving each joint specifically through the fullest range of motion targets the joints, brain communication. And then two, if you're going into a static stretch, you want to hold anywhere from 2 to 31 minutes a day of that time. It doesn't have to be 2 minutes straight or 31 minutes straight. Maybe it's 30 seconds, but 4 times. And that's maybe one session. More sessions, the better the communication is, the faster the results you're going to have from there. But you would stretch and then apply a contraction or squeeze the muscle bellies where you're stretching specifically. So you get the muscles and then you get the joints from there.
Yeah, and I know you have a lot of information here about just how joint capsule integrity can improve mobility, but I liked that and the research proves that.
There's a lot of studies.
The way that the joint is so connected to proprioception, mechanoreception, neuromuscular reflex, postural control, the second you start training for joint is the second you're changing so many more things other than just that tension in the tissue. And I think that's what people miss. That's what they forget. And maybe they just don't know too.
That's definitely
that's probably a lot of it. But one right here showed that cortical remapping of joint control is trainable via mechanoreceptor input, and decline in mechanoreceptors reduce functional ROM in degenerative joints.
Range of motion.
And lastly, then joint capsule stimulation was what can actually enhance neuromuscular reflex, postural control, mechanoreception, and proprioceptions. You just take a look at just all the things that a lot of patients are already dealing with. Just simple joint capsule stimulation can enhance all 4 of those things that they deal with a degenerative or arthritic joint.
Yes.
And that's through CARs, even simply. You haven't even got to all the other things that we can have you do with a patient too. But 100%. Workspaces, especially, versus maybe a static stretch is where we want to shift our mindset to.
Yes. And now let's get another principle of what are different ways that you can address the nervous system's communication to that tissue on an electrical standpoint.
Yes.
So that's where you can get into a couple different things. Let's say, I like this example because a lot of people can relate to this. I have popping, cracking in certain parts. Is it okay? Is there anything wrong with that? I get that question often. Depends on where it's at. Spine's different from extremities and there's different parts and aspects with that. So let's say I'm going through neck or cervical workspace where I'm moving my neck through the biggest circle I possibly can. Maybe I notice a couple pops, cracks, releases. One, is it painful? If not, I'm really not concerned. If it creates a spasm after the pop, crack, and then it forces everything to tighten up, then you might want to be aware of that. There's different ways that you can open up that range of motion. From there, we'll go see a chiropractor, a PT, and do this as an assessment portion throughout your care, if we will. But the main premise is we're getting gas exchange into the joints, and then the popping, cracking, release is almost, so the cavitation is almost gases coming in, and that gets released to a certain extent. Doc, do you want to explain that aspect of gas coming in and out of the joints?
Are you talking about the tribonucleation?
Yeah.
Oh, okay, yeah. And we had a similar idea of what happened in the joint long ago. We were expecting that when the pressure gradient changed with the space gap of a joint, it was basically gases or bubbles releasing.
Yes.
And we found that in a way it is, but it's actually the reformation of the bubble after the space has been emptied is what gains us more, we'll call it space in the joint after an adjustment. And the formation of those bubbles into that empty space again causes a lot of noise. And so it's the reformation of the bubbles after the space is emptied that gives us this small window gap, which helps for range of motion. It can stimulate nervous system upregulation, decrease pain, all these things that we have now theorized. But the noise is actually through the formation of bubbles, not the popping or gas leaving of bubbles in a way. But that has been a pretty helpful change in how we understand the joints in the body, the synovial joints especially.
Yes.
And Dr. Gregory Kotrick was the gentleman behind that study, who's a chiropractor in Canada. And so it was cool. It was really cool to see that we now have really good research to just show what we do as chiropractors. And now they're starting to get into, we already talked about how much the nervous system relies on joint information. So changing that joint mechanic right away does stimulate nervous system cortical mapping right away, and we see that.
Even like fast twitch aspects of like small muscles,
Seriously.
multifidi closer by.
Study on multifidi activation and how that short fast twitch adjustment is one of the only ways to impact multifidi recruitment, stabilization of the lumbar spine, all these things. But I think when we can start to understand that more, it's going to cause us to be more efficient and choose exercises, and outcomes for our patients will improve.
I love that. Yeah, thank you for explaining that. We're definitely opening up and increasing that range of motion, that area of where that gas is accumulating within the joint. So it's okay and safe if that happens more times than not. But that goes back to the other comment, and that the point that when we're going through the fullest range of motion to control certain parts of that barrier, that signal, that area of tightness, that muscle guarding, if you stretch any area, so let's say we're going through our neck workspace, going back to this, we feel pop, it's okay, we're fine, no pain, no sharp pain, we're able to move in that range of motion. Maybe we have more tightness, moving our head in one direction, maybe looking down the armpit, and we'll feel muscle tension on the opposite side and where we rotate. From there, we want to connect the nervous system to the tissues. So we're already stretching, we're at length, we want to create almost like an isometric contraction, or squeezing that muscle belly at range as everything's stretched. Those that aren't watching, you're looking down to your armpit, you're putting your same side hand that you're looking your head to, holding behind the head. So we're stretching, but we're creating a barrier. Now from there, you want to move your head into your hand, into the resistance. So we're stretching and then contracting the head back to the opposite direction, which contributes that muscle contraction. Thus, so the brain's communication at length is ramping up, and your body's, okay, it's safe to move in this area. The more sessions, the more times you can ramp up that intensity, not only will build up the muscle belly, it actually has more of even a hypertrophic effect, to where you can increase the size of the muscle belly, especially when you load at length, or you contribute a muscle contraction as everything's stretched. And then even add in a functional movement that move with a muscle contraction. So we're keeping the resistance with your head going back into your hand, and then we're adding in a rotational movement You're just changing where your hand is holding, but you're still trying to tilt and move into the area of stretch. So then you get all the muscle bellies and the motor units surrounding all these small areas of connective tissue to be stimulated, thus turn off some of the muscle guarding when you come back to neutral and center from there.
And that ultimately was what I was talking about regarding loading the tissue.
Yes.
And really what I focused on when I had really tight traps, which is very similar to what Dr. Jace was doing versus me just doing a simple stretch. So definitely ups your game in getting outcomes when you have issues. There are definitely other things that you can do, but that's pretty simple. A great simple way to get that to improve.
And I know there's one other tool that I think can help a lot of people. So we know we want to stretch and create contraction. Now let's say we want to utilize that. So again, for those people that aren't watching the video, let's say if your hand was closer to a wall or you're stretching and you're putting pressure into an external object. From there, try to go into a stretch as much as you safely, comfortably can. So you feel that stretch reflex. From there, try to activate and bring your hand up off the wall into a hover. You're probably going to notice your body's going to tilt, lean away just to make it happen. But holding that without any resistance, but you're still stretching, forces an area of range of motion to where you can get into. Thus, going back to my point, if you notice popping, cracking, extremities usually have this more to where you're going to notice more stiff tissue tension going over loose connective tissue can create a pop gas release, or some people can think about it like a tendon moving over bone to a certain extent. If you go, let's say you have doing shoulder workspace, I notice a pop crack as I'm rotating my arm back to the side. From there, I would want to hold the arm into the wall. So we're stretching the area, the exact range of motion within about a 15-degree area, and then holding a stretch and then trying to lift up and then add in rotational movement around there. Let's say 10, 15, 20 seconds, and then go back through. You're going to notice a little less popping. You add in multiple sessions and you can open up the range of motion from there as well. So it's like hovers.
So you're stating for patients who have that kind of crepitus noise, that cracking noise, that can sometimes be taken away and improved.
100%. Past injuries, not using it for a longer period of time. So the open up range of motion, you'll have to start targeting specific sections at the same time as you're targeting the deeper signal. So then we get the muscle bellies, we get the connective tissue of ligaments, tendons, but all at the same time as opening up that exact same area. So it's specific there. But
that's awesome.
Yeah. So lift-offs, contractions at end range of motion, full specific joint movements through the fullest range of motion, and then creating that connection between passive and active range of motion opens everything up from there.
Awesome.
Yeah.
Yes.
Now, Doc, in terms of the fascia factor and understanding like the fascia's role, especially between different layers of tissue tension, so the epimysium versus the perimysium versus the endomysium. I guess what are certain things that you've seen with fascia?
Yeah, I think a lot of people don't realize just how neuroconnected fascia is.
Yes.
And when you hear this concept of what fascia is and how it encases muscle, it really is like a web. And it's everywhere in our body. And when you start to see dissections of fascia, it truly is its own organ and webbing and connection. The fascial trains that you'll start to peel off on the body is fascinating. So what I mean by that is there are what are called different specific webbings in our bodies of fascia. And there are different ones that you can have almost complete and quick connection to each other depending on where you are on that part of the train. So for example, the most common one that I like to talk about is the posterior chain. So if you were to take the fascia from the back of the head, you could take it all the way off and it'll go all the way down your back and all the way down your glutes, all the way down your hamstrings and go to your Achilles. That actually is one train of fascia. It's all connected. And when you think about that, you're like, how does that work? One way that I was shown how it's worked is, for example, you can do this at home. Let's say you have a tight hamstring, okay?
Yes.
So you test to see how much flexion of the hip that you can do. You want it about 90 degrees compared to the floor. And let's say you're at like 70 degrees, okay? Instead of foam rolling this side, foam roll your left side, the opposite side, okay?
Okay.
Do it for about 15 to 20 seconds, and then check the side that you just tested. And what you'll find most of the time is you'll gain range of motion. And you're like, how the hell does that work? And it's because through neuromuscular connection, fascial train stimulation, and connectivity between neurons, anywhere you stimulate along the fascial train, that communication will be sent. And so what really it comes down to is neuromuscular control, stimulation, mechanoreception along the entirety of the train will give you way more of an outcome than just treating that area. Yes. Same as what you were talking about when and we're not just going to work one area of the bicep. We need to work it all. And that's the same it goes with fascia. Is if we're going to work an area, same with the concept that we just talked about in the last podcast, which is if you had shoulder issues, it's not just sometimes the shoulder, sometimes it's thoracic spine mobility, sometimes it's inhalation, all these things. And it's the same when it goes to treating tension issues with fascia. So you want to treat the entirety of the fascia. If you have, let's say, low back pain, you want to start treating the hamstrings, you want to treat the calves, you want to treat the core. You want to start getting better engagement of the core in order to flex, to stretch the low back. All these things. And I'm keeping it quite simple. There's a lot more that goes into it, but this is just so you guys can understand what we're talking about.
And Anatomy Trains is a book that will break down all this. Yeah. There's not just posterior chain, like obviously what Doc said, easier to understand that way, but there's spiral lines of fascia. There's ones on the front, the back. There's different layers as well. That's also why when we look at patients, we have to look above and below the area due to compensatory or compensations.
Yes.
Because usually with that line of fascia, depends on where it's at, it'll have that similar communication aspect. And that usually is on a paramecium level, so between small different muscle bellies or fascicles, which also have a same route of fascial plane as that exact same tendon of that small muscle belly itself too. So then you get the Golgi tendon organs, you get the same time muscle spindles, which makes sense on why certain things in certain areas are connected.
Yeah. And the last point I want to talk on, I could talk all day on this, but I think we've already covered most of this. When we think about how fascia is aligned, it is encasing the muscle. It really is. It's surrounding the entirety of it. And fascia is very thick and is web-like, and it can respond to tension very well. And so there are times where it is in a tense state. And so think of it like this. Let's say you have a stretchy substance, but you encase it in a very thick, hard substance.
Yes.
And you're like, how do I get the stretchy substance to actually stretch? Well, you can't. You never will. And that's where this I need to stretch my muscle concept needs to be eliminated, because how you get the muscle to then improve its length has nothing to do with stretching it. You need to load the area, because fascia especially responds so heavily to load.
Yes.
That is what then can reduce its tension by loading that area, neuronal input. So one of the studies that I liked talked about this. It said that fascial stiffness correlates with movement restriction because dynamic loading, not static stretching, reduces fascial tightness. So this is everything that you now talked about with, if we're going to improve flexibility, we got to start with the joint, because there's just so many neuronal inputs to the joint.
Yes.
Among all the other reasons why we'd want to work the joint. But let's say the joint becomes much more improved, but we still have tension. Now it's how do we load the tissue, probably also loading the fascia at the same time to improve what we need to improve. And that, again, all comes from a neuromuscular control, motor units, all these things that we're talking about.
100%.
And I think it's how we change the thought process of treating patients as providers, but also as patients to how to help your own self when you have issues like this.
And I know I can hear these comments coming out already to where static stretching has helped for other individuals. And we're not arguing that. We're saying that there's different, better ways to utilize your time and resources, because static stretching has been shown to induce osteoblast formation, to more or less build up certain areas of bone, certain areas of muscle tension, but a lot of it comes from the signal itself. So there is a time and place to go into static stretching, but there's better utilization of resources thereof. So like there you can, but I'd rather go into active mode.
We're missing a lot of the picture just using that modality.
Well stated.
Yeah.
There's just something small that I can hear the comments already on
and
that.
as far as moving the needle it's just not what you want
Yes.
in any real part of the process when we're trying to really help rehabilitate a lot of these patients. So,
100%.
and then the last thing I just wanted to tie it to yours was this principle that the joint capsule is king, because fascial chains connect to capsular structures. And so mobility drills always must be needed to engage the full kinetic chain from joint to tissue. And again, how fascia responds to neurological signaling. Threat reduction techniques can even enhance fascial compliance, improving joint structure and reducing neurological tightness, improving strength, all these other things. Again, this is just, we'll have some of these tables up on so people can see the rest of the research, but I just wanted to touch on those that tied into what Dr. Jace was talking about, because it does make a huge difference thought process wise when we're looking at this.
And then let's go back to the point that you made where there's like a small or a thicker casing around, let's say more of a stretchier type of substance. Now let's say you want to get to the deeper epimysium, perimysium, so the different layers and encasing of fascia of those specific muscle tissue tension. So let's say you damaged a muscle that's deep in the muscle belly and you're trying to rehab and get some of that scarred tissue, those fibrous adhesions, to lay down and force the body to adapt to back to an optimal healing state for that specific injury, whether it's tendonitis, whether it's a muscle strain, whether it's even a complete tear of the muscle belly. How can you get to that area? Tear of a muscle belly is going to be different for this point, but you can understand where and how we have to address that deeper area. Let's say we want to create glide between tissue tension. There's studies that have shown if you go into foam rolling and you just apply pressure or you go over that area, you're going to notice just compression of the fascia superficialis, or pretty much the outer casing between skin and then the muscle bellies. You don't see that glide between the muscle bellies of the endomysium, epimysium, or the deeper layers of fascia. That's where you have to put pressure and then move the limb. So we're creating compression, but movement, thus the control of the motor units to certain spots of the muscle belly that is damaged. So it's compression with movement.
Would you say that is similar to pin and stretch?
Very similar.
Okay, I just wanted to make sure I wasn't confusing the two.
Yeah.
Okay.
And that's where massage therapists can come into play, and that's why active release techniques of addressing certain muscle bellies help incredibly. That's where PNF, God, what the heck? Something.
I don't remember what that's called.
Neurofacilitation. God, PNF stretching, to where you actively stretch the muscle belly and apply a muscle contraction as everything's stretched. Similar, but more or less it's creating that glide between different layers of fascia is going to be the most important aspect there. But yeah, that's.
So I don't know if you looked into this, Doc, but
Please.
Now we're on this topic, I'm curious.
Yep.
We'll talk about this idea of fibrosis, scarring, right?
Yes.
Scraping.
Yep.
Do you feel that is something that causes change enough to reduce fibrosis, or is that a myth?
I think it will create the change. It depends on, and some of this it depends on how intense the injury is. Because if it's at a deep muscle belly, if it's a deep structure, deep inside a joint capsule, you're probably going to get the healing stage of more or less this fascial superficialis, to where it's pretty much the layer between the skin and then the first layer of muscle bellies. Similar with cupping to a certain extent, to where you're able to facilitate that change, but at the same time, if it's a deeper structure, you might have to get into a pin and stretch, or you put pressure with glide between the muscles. So it depends on where it's at, but then that goes into the assessment, to where, let's say there's an injury to the muscle belly or injury to a soft tissue, let's say the shoulder. You would want to first start at the signaling side, passive versus active. You versus them controlling that range of motion. Let's say there's a huge difference. Okay, that could be a neural signal, that could be due to the injury. And then you would want to see, okay, is there swelling over the area? Is it more hot? If that is the case, you would want to hold off on scraping of cupping, because you're just increasing that inflammatory response.
For sure.
So let's say that's at bay, the swelling's reduced. Okay, so then I'd go into, if you're going to do muscle scraping, if you know it's like a superficial muscle closer to the skin, cupping scraping will help significantly. But let's say it's a deep internal rotator, it's a ligament connects bone to bone. Rubbing, scraping, cupping that area will help for the compensation surrounding, but it's not necessarily going to help for the healing of that specific area, that tissue.
Got it.
You need the nervous system's communication, because if you're going to address a ligament, in order to get blood flow even close to there, to where blood flow is limited for almost any ligament,
yes,
you then would have to go through active range of motion, so you're able to get that blood through those areas and those inputs of where that ligament connects to on that specific bone. And then let's say you're able to tolerate certain areas to where it's still putting stretch, a little bit amount of stretch to that ligament, and then increasing the isometric or muscle contraction. You would first want to start off light intensity, anywhere from like 10 to 50% intensity, roughly speaking. Depends on the severity of injury. And then from there you can ramp up and increase not only just an active or a positional isometric, so where you're contracting the muscle at a specific spot, and then you can contract it with, let's say, hovers, or you go to the end range and then add in some small local movement. Rotational movements usually works better for synovial joints, and then you can build up full body multi-joint movements from there. So
beautiful.
It depends on the specific injury and depends on the specific location, but you can utilize it for the deeper structures, pressure with movement versus more superficial cupping, scraping. Massage works well.
So really, it's part of it, but nowhere near the entirety of taking away it. There's a lot more that needs to be done to lay down that tissue, to improve the tissue. Scraping alone, probably it won't get you there.
Very true.
Good. It's good to know. There's probably still plenty of providers who think we're gonna break up your scar tissue is maybe one of the bigger phrases that we've heard, and to an extent possibly, but there's just a lot more that needs to be done to help the patient. So it's good for us to know that too, obviously.
100%.
I'm sure at one point in time we were told that from some rep, some scraping rep, I don't know.
And if anyone says they can feel scar tissue or fibrous adhesions, they're lying to you. It's such a small and minute detail to where the mechanoreceptors of your fingers, hands, of your body sensations cannot pick that up out of
What
someone
are they
else.
feeling, Doc? What is that bundle of, what are they feeling?
It's usually either a muscle knot to where the whole area is like tense or spasmed, or you can look at it in terms of, I think about neurological tightness, where the whole muscle belly is contracted. So you can notice like a stringing, like a guitar string around the whole muscle belly from one side to the other. You can see it starts in one area and goes to a different area. And if that whole muscle belly is contracted, the only way you can physically get that to relieve long term is by going through the biggest, fullest range of motion. So you're stretching that specific muscle, then you're putting a contraction into the stretch and then away from the stretch. Thus is also known as pails and rails through the functional range conditioning, or you're loading at length with a contraction, so the communication between that brain and tissue is okay, it's safe to move in this area, and it's going to release the muscle tension. But there has to be a progression and a loading influence that you have to build up from there. But
loading away from the issue is new to me. I've always known to isometric hold into it, but loading away, is that more of, it's like opposite eccentric in a way?
It's almost like
resistance away from?
Reciprocal inhibition to a certain extent.
Okay, sure.
But when people hear reciprocal inhibition, if you activate one side of the muscle belly, the opposite side completely turns off. That is not necessarily true. So the principle of reciprocal inhibition in itself is false, but it's almost the act thereof. So if you go into a stretch and if you activate that muscle that is stretched, you want to be able to control the opposite side of the limb to activate those tissues at the same time, so you can, one, prevent compensations, and two, better control your nervous system in certain ranges of motion. I think about it as like a backup system to a certain extent, to where, let's say, the tissues give out, but your nervous system still has the ability to maybe, instead of going to a stretch, but contract as a guarding mechanism at the other end, or the opposite 180 degree of that joint or area.
Okay.
Yeah.
So it's more of a reflex than it is a...
Kind of.
Okay.
And then it helps for compensation. So it depends on where it's at, the localization. Yeah, no, it's something naturally built in, which is very smart.
So Doc, we've talked about cars, we've talked about isometrics, we've talked about pails, rails, we've talked about different activities, or excuse me, passive, active, mobility. We've got it all. So let's challenge these listeners. Let's put all this together and give them your kind of expandability stack here for a reset for their mobility. How would you put it out for them to apply?
So let's start 7 days. If you're going to do this, let's do it. Let's map this out every single day. And it can take anywhere 5 to 10 minutes.
For sure,
So it's something small. It can be done at the end of the day. It can be done in certain breaks throughout your day, at lunch, in the morning, when you start, wake up for the day, either or. So cars, controlled articular rotations or workspaces. You're going to move every major joint, whether it's your ankles, knees, hips, lower back, mid back, neck, shoulder, ball and socket capsule, shoulder blade on the spine, elbows, wrists, and you can go fingers, toes if you like to, but you're going to move each one through the fullest range of motion you possibly can. If you're familiar with this, you can get to the end range, that area of like tightness, and you can build up from there. So it's an assessment tool. Do you have more popping, cracking? Are you able to move this joint more today versus others? If not, maybe that's an area you want to focus on today. Okay, so move each joint, full range of motion, every single day, whether it's morning, lunch, afternoon, night, doesn't matter too much. That's going to be very important. Next is going to be about a couple times a week, ramping up the intensity of your nervous system. So when you think of intensity, let's say you're thinking about squeezing or contracting each muscle as hard as you possibly can. Hard as you possibly can is 100% your intensity. Now let's vary that into the whole body. Are you able to contract a specific area, a specific muscle at 10 to 25 to 50% intensity? So going back through the cars, that assessment, maybe I'm working through my neck range of motion, but I'm feeling more stiff and tense on one side. Okay, so assessing, noting that. Now let's say we want to increase and address that right then and there. Isometric contractions, so we'd go a little bit at stretch, not a whole heck of a lot into the stretch, but a little bit. And then you're going to ramp up your nervous system, whether it's squeezing all the muscles in your body, or if you want to be specific, squeezing that muscle that you're stretching. And then let's say anywhere from like 10 to 20 seconds. So we would want to start off very light, intense, anywhere from like maybe 10 to 50% intensity, holding that, like I said, 10, 20 seconds or so. Or if you want to ramp up, you're holding that stretch, ramp up 10, 20, 25, 30, 40, 50% intensity when you're first starting off, holding that there a few seconds and then slowly ramping back down. 50, 40, 25, 10. So you're controlling that intensity and that communication from your brain to either the full body or that specific area. So you can see where you can funnel the nervous system's ability to rehab and more or less target certain areas via the contraction.
Sure.
Now let's say we want to ramp up the body and the system. This is where you could do this every day, but definitely when you start off, let's say a couple times a week. So we'd ramp up the nervous system, try to go out to, if you're familiar with this, after maybe a few days, a week or two, ramp up to the 100% intensity, keeping there for maybe 5 to 10 seconds, and then ramping back down. Once you're familiar with that intensity, then you can hold that intensity for as long as you possibly can. But there's a rule of adaptability. If you're consistently going into that higher intensity, especially when you're trying to stimulate change, the body will adapt to that intensity, and it's going to make it more challenging for tissue turnover. And that goes back to the Hayflick limitation, to where the tissues are only able to adapt so many times throughout a lifetime, to where you have to vary the intensity and where that signal is going, which then can get funneled for tissue healing, for tendonitis, for joint repairs, for a bunch of all these other things. But let's say if you want general health of your body, your ability to ramp up that nervous system and down, you want to be sparing in terms of when you get into that 100% intensity, but you still want to train it. So maybe if you want to train the highest amount of intensity, full body muscle contractions, and it can even be done in the shower or during work, to where you're holding that 100% contraction of the whole body, squeezing all the muscles of your system, let's say as long as you possibly can. And then going back to motor units, if you're able to do that maybe every 2 to 3 weeks, you're able to generate that intensity, you're able to keep that intensity and put a pin in it, so you're able to utilize that at any time. And that's where you can start seeing how when you're sending that signal to the system, it can build up from there. So it's that full body muscle contractions, varying the intensity levels, and then build up from there. So again, starting lightly, slowly. And then let's say end range motion loading. So let's say you're working out a couple times a week, or let's say even 2 times a week, you're doing an upper body workout, lower body workout. Most people, and it's sad to say, but then when they go into the warm-ups, they think about, okay, let's just stretch the area. Let's do, if I'm doing legs, let's just do a little bit of circles of the hips. Let's do a little bit of jog on the treadmill. Okay, well, that's fine, but let's take this a step further. Let's go into a stretching. If you're going to do stretching, fine. Add in muscle contractions of the muscle that you're stretching, whether it's your hamstrings. If you're doing hip circles, keep doing it. Just maybe go a little bit bigger, a little slower. And then whatever muscle belly or muscle group that you're working on the day, maybe go into a stretch and then feel that stretch and then contract that muscle that you're squeezing 5 to 10 seconds. You add in some full body circles, that full range of motion of the joints, workspace, cars. You're starting noticing that your body is able to absorb the weight. It's almost like you're clearing out the filters and prepping all the muscle bellies, the joint capsules, the connective tissue before you even go into the workout, which definitely limits the risk of getting injured from there.
Yep.
So 1 to 2 times a week, stretch, muscle contraction, 5 to 10 seconds, a lighter intensity on whatever area that you want to focus on. And then go into habits. Now this will be built in to the schedule, so you want to take breaks throughout your day. I know we've touched on habits so many times. Whatever area, and this goes back to the workspaces. If you're doing it in the morning, you start noticing a popping, clicking, or I went maybe bowling the other night, and I'm not usually familiar with bowling. I don't do it too often. My shoulder feels achy, tense. Well, assessment, workspace cars. Oh, maybe it's a little stiff with my arm going backwards because I'm not used to moving my arm back. Maybe I'm going to add in a muscle contraction here, or feel a stretch, light contraction, going through a little bit of mobility on that area. So then you start thinking on the habit side of things. Am I able to address this area today, or do I need to work on a different area? And you can start picking and choosing where you want to address your effort for that day on that side of things, and then tracking it. So whether it's, I know in a clinic we have like circles and then areas to where, let's say, or keeping this in a drill, to where I have limitations here this day and maybe it's a few days in a row, but after a couple days this opens up, but maybe my knee or a different area of the body has limitations, restrictions. Tracking that, if you can see trends with certain activities that you do, maybe adding in different type of mobility workspaces before going into those activities as a warm-up, and you start noticing, okay, maybe I'm not having as many limitations throughout.
Yeah,
So,
I implemented a lot of that yesterday when I worked out my shoulders.
Ooh, love it.
And I went and hung for about 30 seconds, and then I did isometric hold. I pushed up into the bar instead, and so I did that.
Yes.
And then I held myself up again, and I did some very light, like resistant, kind of keeping my weight up on my scapulas, and I just did that very lightly. Now just warming up the area, and then I did cars, 30 to 50 of them each shoulder. I hit them hard.
Let's go.
And I made sure that I did it first, just active by itself, and then I actually added weights and did resisted cars.
Let's go.
Then I hit my workout, and I tell you what, I'm telling you, my performance only improved. I had my ability to go past reps that I'm usually at improved, and I still don't have pain when I do that in my shoulder. Every time that you would show me how to warm up, I seriously don't get a lot of pain in my shoulder anymore. I had a really bad injury to my shoulder, so I'm telling you, even though that I've had past anatomical change to this area, how I recruited motor units, how I did neuromuscular wiring and function, and made sure that I really honed in the other tissues around it before I actually did effort, will protect me from injury and will obviously increase my performance. I still do that with everything that I do, and I'm telling you, it's been so great. So I appreciate you showing me that, because it's been awesome.
Working smarter, not harder. And
Yep.
the better you have understanding of what ways your body can adapt and how specific you can be, opens up the field from there. So
Yep.
maybe I'm not working bis and tris, say, or upper body, chest. Maybe I'm working certain areas of my forearm here, and maybe at the same time I'm working my calf, ankle, foot for that day.
Yep.
And we're building up those specific areas, maybe those specific tissues for that day, and then working on something on the next day. And then you can schedule things out in certain body areas instead of certain muscle belly groups.
Good point.
Yeah.
Good point. Because you'll then have a tendency to not miss as many things.
100%.
Focus region versus small local.
Yeah, no, I love that.
Perfect. Alrighty, Doc. Lastly, we have some myths here that I think are going to be helpful to change the narrative for what we've been talking about. Just another way to quickly end this. Myth, tight muscles need stretching.
Not always. I would say partially myth.
Yes. Tightness often signals instability. You talked a lot about guarding, neuromuscular guarding when we have instability. That's the tightness that most patients probably feel, not necessarily shortness of muscle.
Yes.
Would you agree?
100%.
Good.
It's the ability for the body to give that range of motion, because maybe there's guarding, thus creates that short muscle.
Right.
Yeah.
Our muscles aren't shrinking as far as length, for the most part.
Yes.
Unless you're atrophy, of course, but that's just completely different segment.
Yeah. It's related to guarding of the gamma motor tone, if you want to look that up in depth, but sorry.
Perfect. No, perfect. Stretching increases muscle length.
If you hold it for longer periods of time, anywhere from 2 to 5 minutes, your body will be able to get into that length. But the real question is, are you able to control your body when you're at that length? Myth, kind of fact.
They're basically saying it's largely neurological, not structural.
Yep.
More adaptation than physical lengthening of the tissue.
Very true.
Yep. More flexibility prevents injuries.
Not all the time. It's a very broad question. Let's say, for example, if you're, since it's NHL playoffs, I'm thinking hockey more so. Let's say you're trying to get into, you're trying to turn or cut or do a crossover. You still need that stiffness on certain body areas, depends on certain sports, depends on certain people, to create the power and agility. But to say that if you have flexibility, and not always will guard and prevent an injury per se. So it all depends on that person. So I'd say more on the myth.
Yeah, you hit it all right on the head. Hyperflexibility without control increases risk. So 100%. Not necessarily the fact that we are flexible, but can you control your state of motion, range of motion that you're in?
Yes.
Because without control is an instability.
100%.
Probably, more or less.
Yep.
Sit and reach test is a valid mobility test.
I would say for a general person, let's say a gym teacher, or let's say like a very layman's personal trainer, maybe to see a general understanding of where their guarding's coming from. But if you're going to be very specific, I would say absolutely not.
Yeah.
So.
It does measure passive length possibly, but for functional joint capacity, it completely does not test for that.
Yep.
Lastly, stretching before exercise prevents injury.
Does it say static or dynamic?
Just static. Just static.
Static, no. There can be cases where if you do static stretching before, dependence on certain activities, you can increase the risk of injury. Versus dynamic stretching, to where you're stretching and creating some like localized movement. That can help reduce the risk of injury just based on you move that area, that joint, through an area that's maybe not used to. And then the body's able to understand that level in that area to where it can absorb the weight and force, so it can help prevent certain injuries depending on how they perform.
100%. Passive stretching can impair performance and actually reduce dynamic control, thus leading to possible chance of injury. So this was good. This is great. I hope a lot of you had their minds flipped 180 on this subject, and I really think that it's going to change how you warm up, train, start thinking about, let's say you have flexibility as a goal. I think a lot of people have even had that as a goal. It's not just static stretching practice every day. There's so much more to it.
100%.
And I think taking what you just talked about today is only going to then increase their ability to increase their flexibility, given the nature of so much more neurological input into the joint, into the tissue, breaking down gamma motor tone, breaking down all the other things that we talked about. that's what's going to get them there, versus just static stretching alone. Is there anything else you wanted to talk about, Doc?
I'd say in terms of resources, because let's say each person has the specific stuff that they got going on. So if you need to know how to work the joints, cars, control articular rotations, or even workspaces, there's resources on, I think we have it on the past podcasts on
the body series.
The body series, yes. Yep. I also will put on a resource. I have another YouTube channel, not necessarily it's a plug for that, but it breaks down, it's like a monthly challenge for, I think I did on knees and shoulders, and it goes into specifics on how to address it from that level, so I'll add that as a resource. Or if you just want to type in controlled articular rotations, CARS, for the hips, the knees, there's a bunch of resources there. Sure. So that targets the joints, but then you start thinking about, to be very specific for you, start exploring, get into a stretch that feels nice, and then try to squeeze that muscle that you're stretching. So you have to actually try some of this on yourself, not just like here and okay, I know how to do this. There's that brain to body connection, and then to explain it to someone else, a family member, a coworker, patients, doesn't matter. It opens things up from there. So we'll have a bunch of resources below, but yeah, the body series that has a lot of everything that you need there.
Perfect. Well, everybody, thank you so much for watching, listening. Please share, subscribe. If you found this to be super valuable, share this with your friends, families, colleagues. And yes, we thank you guys so much for watching. Until next time, Doc. Woo! You guys have a great day.
Disclaimer: the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the functional code. Until next time, stay well, stay informed, and embrace the science of living well.